Today we're speaking with a policy analyst from the Federal Reserve Bank of Boston. He studies rural medicine in New England, what's behind hospital closures, particularly of labor and delivery units, and how they might be able to address some of these problems.
Birth rates are so far down in the three northern New England states. They're the oldest states by median age, with Maine being the oldest.
Riley Sullivan is a lead policy analyst at the Federal Reserve Bank of Boston's New England Public Policy Center. For years, he studied the decline of healthcare resources in the region. He's quoted in a brief from the Fed published last month, which says, Maine leads the nation in median age at 45.1, followed by New Hampshire and Vermont. According to the CDC, these states also have some of the lowest fertility rates as well. Maine ranks 7th lowest in the nation with 49.7 live births per 1,000 women of childbearing age.
It just has such an impact when there are fewer births in a year than there used to be, and it still costs nearly the same amount of money to operate those facilities. Hospitals just have to make really tough decisions, and maternity wards are some of the first ones to go.
In 2019, Sullivan wrote about a decline in access to care in northern New England. His report said 22 hospitals in the area didn't have maternity wards. Since then, we've reported on 7 additional labor and delivery unit closures in Maine alone.
Other research has pointed to some cascading effects that has, so maybe younger families might be less likely to locate in those areas if there aren't maternity wards, and it can just really exacerbate the existing trends that are happening.
According to Riley's 2019 report, in Maine, 1/4 of the critical access hospitals and 1/4 of rural hospitals were operating at a loss. Declining admissions, he says, can make it even more difficult to hire skilled healthcare professionals.
If there's a single year that there's a loss, a lot of times these hospitals and other types of healthcare centers can absorb that challenge. They have endowments, they can operate. Some of them have endowments. They can try to make it up in the next year. They can try to get certain grants or certain subsidies.
We asked Sullivan the question which serves as the title of the most recent brief: what stops the bleeding? His earlier research identifies some policies that have helped. Facilities with critical access designations see higher reimbursement rates. There's also the option of smaller hospitals forming affiliations, consolidating their purchasing, human resources, marketing, finance, and contracting operations.
If they're continually operating at a loss, they often need to make major structural changes, which is why a lot of them have opted to close these maternity wards. Some have cited that, it costs them over $1 million a year that they're losing just on their maternity ward. So if they close that, they can try to get a little closer to profitability or at least breaking even.